And now to some health story where the Principal Investigator for Epilepsy Pathway Innovation in Africa, Dr. Patrick Adjei, says about 1% of Ghana's population, estimated at about 300,000 persons, are epileptic. He says due to the high rate of stigmatization of persons with epilepsy, many are hiding, resulting in low access to healthcare as well as increases in risk of mortality. Dr. Patrick Adjei said this when EPINA organized a stakeholders meeting in Prampram.
Disorder in which nerve cell activity in the brain is disturbed, causing seizures. Epilepsy may occur as a result of a genetic disorder or an acquired brain injury such as a trauma or stroke. During a seizure, a person exhibits abnormal behavior, symptoms and sensations, and sometimes including loss of consciousness. There are few symptoms between seizures. Epilepsy is usually treated by medication and in some cases by surgery or dietary changes. In recent times, studies have shown that there is a high rate of stigmatization of persons with epilepsy, and this has led to many hiding the condition, resulting in low access to healthcare. A meeting to improve awareness of epilepsy and its diagnosis to reduce stigmatization in the community has taken place in Prampram. The Principal Investigator for Epilepsy Pathway Innovation in Africa, Dr. Patrick Adjei, says epilepsy can be treated and therefore it is important to show compassion to people living with it. He said epilepsy affects all ages, but the risk is lower among the aged.
We do have an estimated prevalence that about 1% of the Ghanaian population would have epilepsy, and that if we have that estimate, we are looking at about 300,000 people that may be living with epilepsy based on our current population estimates of 30 million or so Ghanaians. We can treat it, and we do not want anybody with epilepsy to feel like an outcast or like it is a disease of the devil or anything.
The Ningo Prampram District Health Director, Madam Giftio Foriansa, said the district recorded 31 cases of epilepsy in 2019 and 17 cases in 2020. She says although the numbers are less, reports by the community nurses show that there are many of such persons in the communities, but their families feel reluctant and shy to report to the health centers for medical attention.
When people have epilepsy, they tend to shy away. Nobody wants to tell you what they have. They hardly come to the clinic for care, and they hide at home or go to prayer camps and end up becoming worse. So this is an opportunity for us to ultimately achieve universal health coverage.
A mental health nurse at the Old Ningo Health Center, Madam Matilda Jani, said most patients that turn up have used traditional medicine to try to cure the condition, which did not work. Some also come to the hospital and stop midway to resort to traditional medicine.
Our greatest worry is that most of our patients are unable to access our unit or our facility because they are unable to afford the medication. And because of the myth and the misconceptions surrounding epilepsy, most of the patients are always hidden in their homes, and because of that they don't come. They have the belief that the herbal treatments are better off than the orthodox medicine. So thereby they resort to it than the orthodox medicine. We are pleading with all stakeholders out there. Basic needs, the pharmaceutical companies that can come to our aid so they can come and help us. Our patients need help. Some have got the NHRS, but they can't renew them because of monetary issues.